Why is anatomy so hard, and how can I make it easier? Anatomy can feel like a mountain to climb for many students. Why is that? The human body is a complex system filled with numerous structures, each with specific names and functions. This volume of information can be overwhelming. Anatomy is not just about memorizing facts, it requires strong visual and kinesthetic skills. You need to visualize three-dimensional structures and sometimes engage with dissections or models. This combination can be challenging, especially since many terms and concepts are new to most learners. Several factors contribute to the difficulty of anatomy. First, the sheer volume and detail of the material can be daunting. There are many bones, muscles, nerves, vessels, and organs to learn. Each of these has its own name and function. Second, anatomy requires visual spatial skills. You need to picture complex structures and their relationships in your mind. This skill takes time to develop. Third, understanding how structures work together adds another layer of complexity. Limited teaching time and resources can also make learning anatomy harder. In many medical programs, the hours dedicated to anatomy have been reduced. Access to cadaver dissections or trained instructors may be limited, which can hinder hands-on learning. Additionally, working with human cadavers can be emotionally challenging for some students, and ethical concerns may restrict practical exposure. So, how can you make studying anatomy easier? Start by breaking down the material into manageable sections. Focus on one body system or region at a time. This approach helps you avoid feeling overwhelmed and allows for a deeper understanding of each part. Using multiple study aids can also be beneficial. Combine traditional resources like textbooks and flashcards with digital tools such as applications and interactive three-dimensional models. These tools can help you visualize structures better and keep you engaged. Connecting structure with function is another effective technique. Instead of memorizing anatomy in isolation, learn how each part contributes to the body's overall function. This contextual understanding makes the material more logical and easier to remember. Identifying your learning style can also help. Determine whether you learn best by seeing, hearing, or doing. Tailor your study methods accordingly. For example, if you are a visual learner, use diagrams and videos. If you are kinesthetic, engage in dissections and models. Practice active learning by engaging with the material. Draw diagrams, teach concepts to peers, or test yourself regularly. Active involvement improves retention and understanding. Allow yourself time for mastery. Anatomy skills develop gradually, so be patient as you build your visual and hands-on skills. Embrace mistakes as learning opportunities. Errors during dissections or practice are part of the learning process and can help deepen your understanding. Lastly, seek collaborative learning. Studying with peers allows for discussion and clarification of difficult concepts. This can provide different perspectives and reinforce your knowledge. By applying these strategies, anatomy becomes less daunting and more manageable. The key is to combine effective study techniques with persistence and a willingness to engage deeply with the material. This approach will lead to better comprehension and confidence in anatomy, essential for success in medical and health-related fields.